Hello, welcome to South Today. I'm Sally Taylor. In tonight's programme, a warning from hospitals. Whatever the symptoms, don't let the fear of COVID delay you seeking medical help. Now, last month, they were so full of COVID patients, people were being sent to Exeter's Nightingale Hospital for care. 4 weeks on, and the Royal Bournemouth Hospital has seen a big fall in admissions and are looking after fewer than 100 people with COVID-19. But pressures are far from over. COVID challenges are ongoing, and there's much work to do to manage the backlog of procedures put on hold during the pandemic. Here's our health correspondent, Alistair Fee.
I can't breathe properly, and my oxygen levels are very low.
Here, there are no thoughts of easing restrictions, of seeing friends or taking a holiday. That is a world away for patients like Stephen.
Never been so ill in all my life. Never. It's just, you've got no energy.
He has a blood clot on his lungs. Conditions like his are rising here.
This is an acute medical complication of COVID in itself as a complication of COVID. So even if you've got over COVID and you've been at home having recovered from COVID and never needed a hospital admission, you are still at higher risk of having a clotting problem.
It's not just his own health that worries Stephen. At home, his wife has COVID too, caught while recovering from cancer surgery, and now sick with the virus and from radiotherapy.
I'm really, really worried. I am really worried. This is the thing. I was going to take all this time off work to look after her, and I can't do that now. I just can't do it. It's so frustrating.
There were 12 COVID wards at the Royal Bournemouth last month. That's now dropped to 3. But however much it's easing up, the shadow of COVID continues.
I've been in some very bad places. I got very hot. In fact, at some stage, I thought my skin was going to catch on fire.
After months of being careful, Tim's luck ran out here. Just as the virus is transmitted in the community, he's one of the small number who have caught COVID in hospital.
I just couldn't believe it, But, I was only meant to be for a few days. I couldn't believe that I'd picked up. I'd quite better at times.
Well, that's what many people have feared, hasn't it?
Yeah.
And that fear has led to some, like Shaji, with other life-threatening conditions, not coming in as soon as they could have.
The pain was from the middle of the heart, not from the side.
So you didn't know how serious it was at that time?
No, at all, not at all.
He's a bus driver and has had a heart attack, but mistook his symptoms for indigestion.
But I definitely say if anyone has any sort of chest pain for a while, they should not wait. My experience says that. It's a lesson for me, to others maybe as well.
It's a lesson for everybody, isn't it?
Yes. And
some are coming in much later, and that's a big concern.
We've had a lot of people that have put their lives at risk by staying at home, and so when we see them after the event, it's very tricky to get them back on track. Heart attacks are very easy to treat these days, albeit with risk and consequence, but at the same time, if the sooner they come, the better they have a chance of getting support.
Now in theatre, Shaji is having life-saving surgery.
So the stent will open the artery, and it will maintain that open artery for a good number of years. And that will improve the blood flow to the patient's heart muscle, and that will remove the symptoms of chest pain and angina that they've been experiencing. The key is, as soon as you develop chest pain, is to get help as quickly as possible. The delay, we know, is quite clear that it does affect both the acute outcome and the long-term outcome. The acute outcome is if you're unlucky enough to have a cardiac arrest while you're waiting with your chest pain, that's obviously very bad. So the earlier the better.
Cardiology is always busy, but as COVID took beds and staff away, the planned care has been down 50%.
There was a time when this ward was operating on emergencies only, and obviously that slowed things down. But as soon as they started opening up again, straight in. In this department, waiting lists are as short as they can be, and they are working very, very hard and doing an excellent job of getting people through as quickly as possible.
Next week, a new ward will see capacity increase here again. And everywhere you go, the hospital is slowly looking to chip away at the long list of patients waiting to come in. But the demands and the risks of COVID-19 are not going away. Alistair Fee, BBC South Today.